Well, good morning and thank you for joining us today. My name is Mai Miksic. I'm the Early Childhood Education Policy Director at Public Citizens for Children and Youth, or PCCY as we're known. We're so glad you're able to join us today to talk about a really important issue. We've heard from many of you, childcare providers and out-of-school time providers this year about the struggles you've had over the past year. In addition to dealing with the pandemic, you've been a lifeline for parents and their children during this time of great need. Many of you have reported that you've seen a dramatic increase in the mental and behavioral health needs of the children you care for. Today, we want to provide you with some tools to help you navigate the behavioral health system in Philadelphia. Our goal is to give Philadelphia childcare and out-of-school time providers, some of whom are caring for Philadelphia School District students, the knowledge and tools to successfully connect their students and families to behavioral health services. Today's focus will be on students who have medical assistance coverage, because many Philadelphia School District students have medical assistance, Keystone First, Health Partners, Aetna, and United Healthcare. And we will also provide some information for students with CHIP and private coverage. I'm going to pass it on to my colleague Colleen, but before I do so, I want to note that you should feel free to use the chat today to interact with us, and also the Q&A function. We will have time for questions and answers at the end and are happy to take your questions at that time. So I'm going to pass it to my colleague Colleen now.
Thanks. Good morning, everybody. So glad to be with you this morning. I'm Colleen McCauley, and I direct health work at PCCY with Mai. And we are really pleased to have some folks on this call to share their longtime experience providing critical behavioral health care to kids. I'm going to introduce both of our speakers right now. Dr. Grace Ryder, she is at Children's Crisis Treatment Center, or CCTC. Some of you may know them by their acronym. She has been at CCTC for 20 years and is the Director of Best Practices and Strategic Initiatives. CCTC's main office is down on Delaware Avenue near Spring Garden, and they've got a staff of 400 caring for 2,400 kids and families. And they're dedicated to addressing the impact of child abuse, neglect, traumatic events, and other challenges to early childhood development and assist kids reach their full potential in their houses, community, and society. And I'm so pleased to also introduce you to Jessa Galloway. She's at Cora Services, and they've been providing care to kids and families for over 50 years. Jessa is the Clinical Director of Intensive Behavioral Health Services. These are some of the services being provided in the Philadelphia School District. And Core Services are headquartered in the Northeast. And their mission is to assist kids, youth, and families experiencing emotional, academic, and social challenges which impede their development and productivity. And of course, help them reach their full potential as well. Both Core Services and CCTC are providing services to kids in the Philadelphia School District. So without further ado, we're going to start off this first section talking about how to refer any and all kids to behavioral health care services. So I'll hand it off to Dr. Ryder.
Thank you so much, Colleen. And I want to thank PCCY and particularly Colleen and Mai for setting this up, because it is such a critical issue. And I want to thank all of you for joining us, demonstrating your commitment to our kids and families. So, Jessa and I are going to today kind of briefly review pathways to connect children to services. But we do want to leave a lot of time for questions, because we really want to target this presentation to your needs. So I'm going to start off by just generally describing how you can refer any and all children to behavioral health care in Philadelphia. Now, there are several pathways and really no wrong doors. I mean, some of you have maybe found one way works a little bit better than others, and please continue doing that. And then others may find they have to try different pathways, and so we want to outline those today. We also know that there are different circumstances in which you may be wanting to connect children to services. So we know sometimes parents are ready to take action in connecting their children to services. And you may find that, we do understand that, of course, the pandemic has exacerbated any issues that children and families face. So, we expect that as things begin to open up, that referrals are going to increase substantially. And we're ready for that, right? We're expecting it and we're ready for that. So if a parent is ready to take action, what you can do is suggest to the parent to contact directly the behavioral health agency of their choice. Now, this is for a parent who may be familiar with the system and know who's available. But I think what's important to understand is that a parent can take their child to any behavioral health agency in the city. It's not restricted in any way for most services. So we're going to go into where it is restricted in a bit. Actually, Jess is going to cover that in a little bit. But as you're first connecting a child and his or her family to services, they can really call anybody. And that might be where they need help. They may need to have a better understanding of what is available to them. And I know PCCY has been kind enough to put together a sort of a cheat sheet for you around that. So what you can do is encourage the family to connect with the behavioral health provider and ask about what services that they have available. And the other option is that the parent can actually contact the behavioral health agency that is working with the student's school. So if this is a school-age child, every school in the city of Philadelphia is connected with a particular behavioral health agency, and that is new. So we're all adjusting to that the services in the school have become regionalized, and Jess is going to talk more specifically about that. But that is another option. The family may be, well connected with their school and can talk to the school counselor, and the school counselor can help them connect to services. Okay. So the other option, if that feels a bit too overwhelming, is that the parent can call community behavioral health directly. Now, many of you know that community behavioral health is the managed care organization in Philadelphia, okay? So there's only one managed care organization that oversees all the behavioral health, mental health providers in Philadelphia. So, that's in many ways convenient because there's only, one number that they need to call. And they can call CBH and ask about organizations that provide behavioral health care to kids. And now, they can also ask for adults, but here's, given the focus is to children, because not all organizations provide services to children. What happens here at CCTC, and of course Cora, we do focus on children. And then another option is to just use the CBH's online provider directory. Now, my understanding is they are revising that at this time, but it is available. And because, for example, the family may want to go somewhere that is within their community, because we know transportation, getting to and fro appointments can be somewhat challenging to families. So they may want to know what their options are in their neighborhood, in their community, and that would be easily found on that directory. And you'll have the number to CBH pretty handy, but just in case, it is 215-413-3100. Okay, and they have folks, all set up to answer any questions that a family may have. Okay, so that's the best case scenario, right? The family is ready and will follow up in contacting someone that can provide the service. So, but we know realistically that that sometimes parents and caregivers need more support to connect to services. So, what we find that works really well in those circumstances is to actually offer to do a three-way call with the parent to a behavioral health provider or to CBH, or you can even, both together call the counselor at the child's school and have a discussion with them around connecting with behavioral health services. And we just find that this support works really well for parents who are feeling overwhelmed and not quite sure what the next step is. Okay. So that we definitely suggest doing that. So now we also understand there are times that you may have concerns about the child's behavioral health, but the parent may not agree with you for various reasons. And with that, we understand it is more difficult. Now, one of the things you could do is contact the child's school counselor and maybe have a consultation with them about how the child's doing at school. Because that might be, I do find that if you talk to parents about their school progress, they're really motivated to have their child do well in school. And that may be, a topic that they're able to discuss behavioral health around that topic. And to make them aware that these services are available in schools. And that may motivate them to work with you in connecting with behavioral health services. But the counselor could possibly give you some advice, and you can kind of team up to get the child what they need and to work with a parent or a caregiver. Now, you can also reach out to a behavioral health agency to get similar support, possibly identifying the behavioral health agency that's within the school and having a consult with them. But I would add with this is you want to be transparent about this with the parent, because we can all imagine how that would feel if folks are talking about their child without their knowledge or knowing what's going on. So, I definitely think that the best scenario is to call them together, but you can always, at least reach out and get some advice and, and start, kind of building that ecosystem around the child to get them what they need. Okay, so that's really a general overview, and we can dig into some more specifics later on in the presentation. I did want to add that for now, most of the children you serve likely will have Medicaid, but some of them may have CHIP, and CHIP really does operate differently. So that's their insurer. So rather than CBH, it's a CHIP provider or private insurance. So there, you could always, with the parent, call the 1-800 number on the back of the child's insurance card and ask for names of behavioral health agencies to contact. You can find a provider using CHIP or private plans online through their provider directory. And, it is, I have to say it is a bit complicated because different insurers have different CHIP products. So it's not the same across all insurers. So it would be really helpful for you to talk to the insurance agency to know what's available. But many providers who have Medicaid, who serve children on Medicaid, also have some services under CHIP. They tend to be outpatient. They tend to be more the traditional, because CHIP doesn't tend to cover the higher level services. But there is a way around that, and we'll actually talk about that a little bit later. So, so there is a general introduction to all of mental health services, not necessarily school-based. And it is generally a good idea to start with a general intake at a behavioral health agency if you're unsure what level of care the child may need. That's a really good place to start. But for children that your thought is that school-based services, which tend to be more intensive, are appropriate, I'm going to pass it over to my colleague Jessa, who's going to go into a bit of detail of what types of services are available in schools.
Thank you, Grace. Just before you start, Jessa, I would like to introduce Tony Valdez. He is the executive director at Children's Crisis Treatment Center. And so Dr. Ryder and Tony work together. Thanks so much, Tony, for being here to be able to interact with us. And then I do want to mention someone asked for some information to be repeated that Dr. Ryder shared. When Jessa when she completes her sharing her information about the school-based services, we're going to put a document that reinforces all this information into the chat, so you will have access to it. Jessa, take it away.
Okay, thank you so much, Colleen. And thank you, Colleen and Mai, for inviting me to be part of this. I'm very grateful to be part of this discussion, and I would be happy to answer any questions that come up today or moving forward. So Colleen, you have my permission to also share my contact information as well after today's session. So thank you again, Dr. Ryder, too, for presenting the overall scope of how to be connected to services in general throughout the city. What I'm going to talk about more so is how to be connected to behavioral health services utilizing your school. So as mentioned, and I'm going to piggyback off of a lot of what Dr. Ryder had shared with all of you today. So to piggyback off of what she had said, yes, every school does have an assigned behavioral health provider. So every Philadelphia public school, and most, if not all, charter schools, they have them assigned. Sometimes charters, it's a little bit more difficult because they don't know necessarily who their assigned behavioral health provider is, but everyone should have one. So every Philadelphia public and charter school does have an assigned behavioral health provider that can provide these services. So, when we're talking about the intensive behavioral health services, that's the IBHS services in the city of Philadelphia, the city has regionalized these services for quicker access and for purposes of overall improving the services in general. So, as mentioned earlier, if you're going through your school to get these services and access these services, you're going to hear a lot about clusters, and we'll talk about clusters. So the city is organized into clusters, and everyone's assigned an IBHS provider through their cluster, and their cluster really is dependent upon what zip code the school is located in. But I'm skipping ahead a little bit too much. So let's go back to where eligibility starts. So as you talk about IBHS services in schools, a lot of questions come up insofar as who is eligible. So for this specific school-based program, it's students that are eligible. Everyone has to have MA, as mentioned earlier, so medical assistance, Medicaid insurance, in order to be eligible for this service. And these students would present with more intensive needs. So those needs can be anything from, intensive behavioral needs, focus needs, behavioral reinforcements, social emotional support, and they have to meet the criteria of a treatment diagnosis, right? So they don't necessarily have to be previously diagnosed, but they would have to come into our services. They would get an assessment to to determine what is an appropriate diagnosis in order for them to receive treatment through under the IBHS umbrella. So I talk about this IBHS umbrella because there's a lot of services that are offered to the children and students that come through our programs. And what these different services look like are kind of in a tiered fashion, but also with a team approach. So services that are offered are behavioral consultation that really works with the family to support them to come up with a treatment plan, create a treatment plan that directly relates to the presenting concerns and presenting, problems that are evident that need to be worked on. Oftentimes the mobile therapist is introduced into this team, and a mobile therapist can help support the parent and the student on a weekly basis insofar as addressing those social and emotional concerns. And then there are behavioral health technicians, which a lot of you may remember were TSSs in the old BHRS model, and now they are called BHT, so behavioral health technicians, and they're in the schools, they're in the homes, providing the one-on-one support and really implementing that treatment plan and addressing those behaviors of concern. What is new about this model, what has been a great addition into our IBHS model, are our care coordinators and our family peer specialists. So as I talk about this team approach, we've added these components insofar as the care coordinators can help address any kind of case management needs that the family may need, or the coordination of care across entities, whether it's school, agency, outside providers, different professionals that are involved in the case, maybe EI into transitioning into school aides and so on and so forth. And then our family peer specialists really focus on that advocacy piece, right? Giving the family a voice, supporting the family, the client and the parent in really advocating for the needs of the clients, as well as, providing that ongoing kind of just positive relationship and positive interaction for the family. So that's the overall umbrella and model that falls under this IBHS service. There's questions a lot of times as to, how frequently can these services happen and how, what are the locations? So it is essentially a wraparound model. So these services can take place in schools, in homes, and also in the community. So again, it's supposed to wrap around the client and the family, the services, and that's why it's, from the old model, it's called wraparound. We're kind of getting away with that with the new model, but the services are meant to be able to be deployed in many different locations. And then timeframes, it's throughout the week, it's on a weekly basis, and it's a school-based service. So a lot of the support will take place in school. I know we had a crazy year with COVID, and that school support was put into place a lot virtually by IBHS staff, and now we're starting to get back into schools and really provide that support in the schools as well as the home and the community. So that's what that looks like insofar as just a quick brief overview of this service. If there's any OST programs or early childhood education programs on this call today, please feel free to reach out to Core CCTC if we're your assigned provider in your schools. And then other providers are also looking into identifying who their OST and early childhood education programs are in their school buildings, so that we can provide more information as to how to access services, and we can explain our services even more, so our school-based IBHS services. So feel free to reach out, and we also as agencies are starting to reach out just to give this information to you all, to these programs specifically. If we're looking into who is providing care, right? So I just went over that umbrella. It really is, I do really want to reiterate, it's a team approach, right? So it's a treatment team who is assigned to the student. So it's really, I know it might be overwhelming for some parents that it's a lot of people providing the treatment team, but how that gets determined is through the assessment process. So let's talk a little bit about how you refer a student to the school, our school-based IBHS service. So once you're able to identify who your regionalized IBHS provider is, you would, complete a referral form. And again, Colleen has the link that she'll share later of all of the IBHS providers in the city. There's 27 of them. And then who is assigned to what cluster or what zip code. So it's important for you to identify that first of who is, the school's identified IBHS regionalized provider, and then you're referring your students to that provider. So when referring, you, as Dr. Ryder said earlier, you always want to speak to the parent first, right? You want to express your concerns. You want to tell them, what you're noticing, and then, get the parent buy-in, get the parent's motivation to actually want to take that step to then go and talk to the school, right? So during the school year, you're going to directly connect the parent to the school counselor. For a lot of our IBHS programs, our school counselor is our main go-to, and a lot of the referrals are generated through the school counselors. So I want to encourage you to talk to the parent first, once they're motivated and they're agreeable to this next step, having them talk to the school counselor about referring them for an IBHS program. The school counselor will then take it over from there, help the family to complete the referral form, and then make sure the referral form is sent to the regionalized provider. During the summer, I know we're approaching summer. It's a little bit, it's not that it's more complicated, because these school-based behavioral health care services are still available at a different capacity, but the school counselor is not always accessible. So during school months and during the summer months, you can encourage the parents to reach out directly to the provider, or you can, also, again, just directly contact the behavioral health agency yourself, or if there's anyone else working within a school program. I know sometimes students go into like summer camps or extended school year, or maybe it's a school, like a Philadelphia School District sponsored event or summer program. You can always ask if there's someone that helps with referrals, and if not, you're just directly contacting the behavioral health agency yourself, and you're encouraging your parents to contact them themselves. If a parent is not ready, I know Dr. Ryder spoke to this a little bit earlier during our presentation. So if a parent's not ready, for services, you can still always seek consultation through the child's school counselor or school teacher, or even from the behavioral health agency. And what that would look like is, a phone call and saying, I have a child here, I'm really concerned about, him or her, and here are the presenting concerns. What services may be available to this family? So on the back end, you can get information from behavioral health providers insofar as what is offered to, a child of concern, so that if you go back and you have this conversation with the parent again, and they're, willing and able and motivated to participate, you'll at least have the information. So a consultation is always recommended, even if the parent at that point is not really, you haven't had their buy-in and they're not motivated, initially. At least you can do the research insofar as like, okay, here's Cora, here's a really great, provider, here's what they can offer. Does any of that sound good for you, moving forward? And then we meet the parent where they're at. We always have to meet the parent where they're at, their parents or the guardian, because that's who's really going to drive the referral. And, behavioral health agencies always need that parent or guardian permission to do so to initiate services.
That's great. Thank you so much, Jessa. That's a very comprehensive picture.
You're welcome.
We're going to move into some Q&A in just a few moments. I will direct your attention that we went ahead and put in the chat a link to materials for this training. There's a handout that, again, reinforces everything that Grace and Jessa have shared about how you can refer a family. Then we have a handout that you can share with the parents and caregivers you work with. You can give it to them about how they can also refer their kids. And then we have that list that Jessa referred to. It's alphabetical by school. And the behavioral health agency that's assigned to that school. And finally, it's a list of behavioral health agencies in the region that accept CHIP health insurance. So it's just a backup way for parents with CHIP to, to find a provider. So before we do go into Q&A, there's a few important pieces of information we wanted to cover. So, and to go back to you, Dr. Ryder, Would you say a little bit about, in a minute or so, if I'm a childcare provider or after school provider and I have a student who I think has more extensive needs, but the school team decided that the child doesn't qualify for the more intensive services, what happens to that child?
So what the school team is expected to do, and specifically the Behavioral Health Agency, and what we here at CCTC do, is if the child doesn't seem to need that level of care, and I would even back up a little bit, because sometimes we get lost in the language, but in behavioral health, there are several what we refer to as levels of care, and they, for the most part, refer to the intensity of the treatment that's provided. So the lowest level of care is something you're all familiar with, and that's outpatient treatment. Where the child and family come in for a 50-minute hour and meet with a therapist. And then you have, the most intensive level of care, which would be, for example, psychiatric hospitalization or a residential treatment facility. And in between those two, there are myriad services that the child may have. Okay, so as you can imagine, as the services get more intense, they're meant to match where the child is at in terms of their mental and behavioral health. So there are times where it's not absolutely clear at intake what the child would need, and that's the whole point of an intake assessment. So sometimes within a school setting, an intake assessment will be done at the school, but it will be determined that actually the child doesn't need that intense level of service. And what will happen, and Jessa mentioned that there are care coordinators that are a part of the IBHS, and that is one of their primary roles. The care coordinator will connect the family to a provider that can get them what they need. Okay, that is one of their primary functions. And what they will do is what we often refer to as a warm handoff. So they will work with the family. They'll call, they'll call them together. They'll schedule an appointment. They'll help the family get to the appointment. They'll make sure the family did get to the appointment, and if not, they'll work with them to reschedule. So they'll really, support them in getting that level of care, because it's critical. Because that is, in many ways, every level of care is prevention for the next highest level of care. Mm-hmm. So so we really want to connect children and services as early as possible.
Mm-hmm. Great. And Jessa, so if we go back to some childcare providers and after-school providers are going to have students that have CHIP or private insurance. And if a child with CHIP or private insurance seems to have more extensive needs that could be well addressed by the school-based program, is there a way? Could you describe the way? Describe the way that a child with private insurance or CHIP might be able to access the services?
Yeah, so just, speaking off of, what Dr. Ryder had said, is there are oftentimes at any behavioral health provider agency, there are case managers or care coordinators. So if a child has CHIP, there's more than times they may be eligible for medical assistance insurance. So it would be pulling in that behavioral health agency and the team to help assist the family in applying for medical assistance insurance. And again, there's something through the insurance that's called the loophole, the page 95 loophole, so that if your child does have a diagnosis, they may be eligible for the medical assistance automatically through the page 95 loophole. So then we would pull in, any behavioral health agency could pull in a case manager or care coordinator to help a family apply for that medical assistance. And any behavioral health agency is familiar with that process and can help parents do that. many school counselors are also aware of it as well, and they can also help parents, or at least give them, you know, a website or a phone number as to how to apply for medical assistance to see if a child qualifies.
Great, thank you. And to add to that, Public Citizens for Children and Youth, we operate a health helpline, and every day over the phone for free and in any language, we help a caregiver apply for medical assistance and CHIP. And we have a lot of experience helping parents who have CHIP or private coverage make the case for why their child needs medical assistance for a special healthcare need like behavioral health. So you'll also see in the handouts, you'll see PCCY's helpline phone number there that you can call for questions or refer your parents to for help. So now we're gonna go ahead and open it up to your questions. Maya, I'm not sure if there are any questions already in the chat or if there are questions.
We do have some questions.
Great.
And I think I'm going to first address the one question that has been asked a few times, which is, do we have resources for providers today who are in the suburban counties? And that's something PCCY will follow up on. We know that there are providers here today who are in Montgomery or Delaware or the surrounding counties. So we're very aware that's it's a different system, but also a lot of the issues are the same. So we'll follow up on that. Another question that I got through email, and then also there's some questions similar in the Q&As about infant, toddler, and preschool age children. So we've been talking about school age children till now. I was wondering if Dr. Ryder or Jessica could talk about services for that age group, those age groups.
Mm-hmm.
Briefly.
Dr. Ryder, do you want to go first?
Sure, thanks, Jessica. Sure. So I can, of course, talk about CCTC in particular, and then Jessica can share, because I know they do some early childhood services as well. But CCTC actually starts as young as 18 months. Now that's particularly for children who have experienced a severe trauma. That we start that young, and we do have a particular model that we work with children and their families together in approaching the trauma work. But in general, all of our services start at age 2.5. So we have, for example, a therapeutic nursery, which is a school-like setting, but therapeutic in nature. And in our outpatient program and many of our other programs work with children as young as 2.5. So there are services. Many agencies do start at age 6, but there are providers out there that provide services for the youngest kids. So Jessica?
Mm-hmm. Just speaking to Cora, we do have 3 early childhood education centers, and we can take toddlers as young as 2.5 in these centers. And in these centers, if there's special needs, we can help address them. We do have OT, PT, and speech therapists. And we're also looking at each of these programs to become more like an all-encompassing to actually address the behavioral health needs as well. So we're looking to roll out like an ABA program, which is Applied Behavioral Analysis Program, in our early childhood education centers. It's not up and running yet. And we can see children again as early as 3 for that type of intensive behavioral health service.
Great. Let's see here. Marie Davis asked, how do I create an environment that supports my students who have gone through trauma, and how can I encourage their parents to get help?
So I can jump in again, and then Jessa. So part of the challenge with that question is I could keep all 111 of you on all afternoon, but I won't do that to you. Right, Jessica? So, because the thoughts that it provokes are, it's about, creating a trauma-informed environment, within your school, within your classroom, or within your setting. And there are particular ways to do that. And then within the context of a trauma-informed setting, to create really, positive behavioral health approaches with all of the children, and particularly the children with more needs. So I think that, it's a bit out of the focus of this particular presentation, but I do love the question and the thinking behind it, because it really is about creating that environment for the children and families where they feel safe, and as they continue on their developmental trajectory. Jessa, would you add to that?
Yeah, no, I agree with completely with what you're saying, Dr. Eiders. Is creating that safe environment, right? That environment, even though it has to be trauma informed, should be safe, right? And I think that's how eventually you would get a parent's buy-in or motivation to take the next step. That takes a while, right? And that looks different for every parent and child, that you see in your settings. It could take a day or it could take 10 years, you never know, but it's creating that safe environment for them to speak about their issues, and also showing them that you're there as a support to help get them to the next step, or the more appropriate level of care or service, as mentioned here today.
Great. We have another question about, I think, getting resources for parents. So Shirley Hugh has asked, we have a few children that have some aggressive behavior. They throw things, flip chairs, trash the classroom. We've had to remove the children when these behaviors occur. How do we find resources for the parents? So I assume, based on what you guys have talked about so far, is start with a conversation with the parents, right?
Right. Start with the conversation with the parents. Ask the question as to what behavioral health agency is linked to that school, or that, that provider, that early childhood education center. And that would be a reason to refer, right? So it's starting that referral process as long as the parent's agreeable, and then they can come in to any provider, get an assessment to determine, where can this child best be serviced? Is it through an IBHS, an intensive behavioral health service, or is it through a different level of care? So again, it starts with having the conversation with the parent, getting the school involved, and then, connecting with the behavioral health agency that's assigned to the school.
Great.
Yeah, that's absolutely right. And the only thing I would add to that is the understanding that when providers like Cora and CCTC are working with children, they're also working with the parents, right? So, we're of course not, working with children in a vacuum. So really often the focus of our attention is on supporting the caregiver and parent. Because you start, there's a line where you start discharge planning the first day of treatment. And it's really about helping the parent and caregiver get the resources they need so that they can, support the child in going forward.
Great. Leslie Spina asked, when do you guys know, or have you heard when face-to-face support might resume? So right now we had alluded to a lot of supports being virtual because of the pandemic. Is there any news on that front?
No, I think it varies, and Dr. Ryder, correct me if I'm wrong, it varies from provider to provider, right? And it depends on safety precautions, in every city. So it really depends on the provider itself, what they're offering. And I know, like for Cora, I can speak to Cora, we're slowly starting to reopen up in-person services, and that has jumped over the past month, but we still are offering those virtual services for children and families who want that option, right? That feel safer with that virtual option. But again, I think it's going to vary across providers, and what and how they can support their families, and what's comfortable and what's in their policies and procedures.
Right. Yeah, I think that's right, Jessa, and that providers are are making their own decisions in moving forward. And so, specifics about CCTC, we are offering in-person services. We have been for a bit, but it's absolutely up to the families whether they want to come in or not. Otherwise, they have been offered virtually since last March. And we are in our school. So, so Cora is in a particular, number of schools, and then CCTC has particular schools they're in. And our staff have moved into those schools and are providing services. So, so it's happening, and it's in, like Jess has said, it's ever increasing each week.
Deborah Zeben, I'm sorry to butcher your name. If our childcare center is a provider for the school district, do we have an assigned behavioral health agency? Or is it just the school district, the school itself?
What school is it?
And we'll see if Deborah can type in what school specifically it is, but in general, it sounds like it's the school that's assigned the behavioral health agency, not the like individual providers, childcare providers are not.
So I have a feeling Antonio is dying to jump on this question.
I see his face and he wants to.
So, right.
Thank you.
Right.
Thank you. Thank you.
Go ahead.
So,
he is only 10 feet away from me down the hallway, but he is bursting out of his office.
So this is a really important question on two fronts. Number one is the way they're both Jessa and Grace have talked about the clusters versus traditional referrals to directly to agencies. So it's really important we start with that framework, right? That you can go either of those directions. You can go to an agency that you're familiar with, that you trust, or you can go through the cluster that the school is in. Having said that, the way that these clusters have been assigned, they're assigned geographically. The schools just happen to be in those zip codes. So, two answers to your question. One is when you think about where it's what zip code, what area, your child care center, your Head Start program, whatever it might be, where it falls geographically, there is an agency assigned. I think, Colleen, am I wrong? Has that been shared as part of the materials that have been shared with everybody?
That's correct. And Tony, it's been shared by alphabetically by school, so people aren't actually seeing the cluster.
But your zip code, when there's going to be an agency assigned to that zip code, so that agency is responsible geographically for those services. I was going to say something bold, which is that second half of what I was going to say. And I know, at least with Cora and CCTC, we're both moving forward with this kind of thinking when we've talked about this, is that we're already trying to collect the names of all the childcare, early childhood providers, independent ones that are in the geographical areas that were assigned. And our intention over the next several months is to begin doing some outreach to begin to make connections. I would recommend to you guys, I know other agencies may be upset with me for having said this, but I would really recommend for you guys that to start thinking in that perspective of how to build a partnership with the agency that's responsible for that geographical area. Where eventually, depending on the agency, you might even be able to have some presence in your school, in your facility, or on site where someone's coming in on a regular basis. That's our intention. I can speak for CCTC. Our intention is to begin to build those kind of relationships with all the childcare providers in the area that we're responsible for, and to build that up over time. Now that's a long term. Obviously, this isn't going to happen next week, but I think these are things that will be, in the long run, we're all going to feel better if we have these go-to people that we can work with on a regular basis and can consult and support and talk about all kinds of different things, not just the individual kids that we're working with. So I would recommend that you start reaching out, not just for kids, individual kids, but for that partnership.
Thank you for that, because Cora's framework and path of action, it lines up with CCTC's and what Tony's been talking about. we're trying to reach out to providers, but if you know that we are your designated provider in the region, reach out to us as well. We can, start those partnerships, build those partnerships, and help support the centers, that are within our region, throughout the city.
Crystal Lopez asked, do you come into the early childhood centers and provide services on site?
So for CORE, it really depends on what the need is, right? And where those needs fit through the programs that we provide. So, it's kind of a yes, but, right? So it depends on what the needs are for the children. And like right now for our early childhood education centers, everything's in person. We go into the centers, but could we go into centers that are not, CORE sponsored buildings? Most likely, yes, but it really depends on the needs and how we can, come up with the best case scenario insofar as the supports that are needed for those children in those centers.
Yeah, that's absolutely right. And I mean, what I would state is, there's been more of a focus on the schools, right?
Mm-hmm.
And building behavioral health teams within schools. But what I can say is that, the providers on the call with you today are very interested in, as Tony had said, developing partnerships.
Mm-hmm.
So whereas now the system is supporting teams existing within schools, that support isn't as strong for early childhood centers. But what I can say is we'd like it to be. Mm-hmm. Right? Because again, this is regionalized. So whereas the system is more focused, set up right now that it would be in the individualized support in your child care center, we would like to move that towards more support for the whole center. And actually it refers back to the question about how to create a safe, therapeutic, and trauma-informed environment in all the classrooms. We would love the opportunity to support that work, and we are going to advocate for that, within the system to move towards that goal.
We have a question about children in private schools, private centers who are preschool age, 18 months to 6-year-old. And I guess we just revisiting the question about maybe private insurance and where do you even start with it's probably similar, right? I don't know.
Right. And it goes back to, something that was mentioned earlier by Tony is like, if that private school is located in the region that a certain behavioral health agency is providing service, they could possibly qualify, right? Depending on the agency and what the agency offers for that age range. Like, again, for CORE, we can service, someone as young as 2.5, but for our IBHS program, it's someone, as young as 3, but it has to fall within our region, right? The region, the zip code, or the area. So again, it goes back to that regionalization. And if a private school, like right now, we have a group of 10 private schools that we're in because they're in our region, right? And they are private Catholic schools that are kindergarten through high school that we service because they fall within our region. So this, and just speaking specifically to the IBHS, the Intensive Behavioral Health Services, we're able to provide that for those students in that region in those private schools.
Someone is asking about Elwyn, which is one of your peer organizations. Do you guys know, they're typically the agency for childcare centers? Are they still available? What their situation is? Do you guys know?
I'm not certain.
I'm going to take a guess.
Mm-hmm.
And also make a clarifying statement. So I assume Elwyn is still available and still providing services.
Big
but
provider.
Largely, historically, with the kinds of services they focused on in early childhood settings were services other than behavioral health. So it was speech therapy, occupational therapy. And although they do have some behavioral support, that really wasn't the focus, right? So it's more, how I view it more so is these are complementary services. So, if you have a child with speech and language needs, you should absolutely, 3 and above for Elwyn, that you should absolutely reach out to them for those types of services.
Mhm.
But for behavioral health, I think the best route is what we have reviewed today.
Mhm. So we're coming down to 3 minutes to the hour. I'm going to put my email into the chat. You probably have access to my email through the invitation to today's event as well, but we're happy to try to connect you with resources outside of this webinar. And I also wanted to mention, because this has been asked a few times, do we provide credit or certificate for attending today's webinar? And unfortunately, we do not, as a non-accrediting body, but we hope that you found today's webinar helpful. We're still here, and we've shared the link a few times now to the resources that Colleen had mentioned. And I just want to say thank you for attending. I want to let my colleagues here also say a few last words.
Well, I want to thank everybody for coming today, and I too hope you found this useful, and Jessa has offered that you can contact her. And I want to be fair and not everybody contact her. So you can absolutely contact, I'm teasing. You can absolutely contact me as well. And, if you have any particular questions about CCTC, of course, don't hesitate to reach out. But I really hope that you found this helpful, and please let PCCY know, and other things that may be helpful to you as well.
Absolutely. Thank you for participating today. Again, Colleen and my thank you for having me participate, asking me to participate in this. I did put my information in the chat. So if anyone has questions specifically about Cora, what Cora has to offer, you can reach out, or any questions based on the presentation here today. I'd be happy to assist and answer your questions. And hopefully we'll have future webinars, focusing on behavioral health services in general, and maybe more specified topics or requests can be sent Colleen's way or PCCY's way, and we can, create future webinars for all of you.
Great. In fact, I'm thinking, Jessa, perhaps maybe the next session is the question about how to create a trauma-informed approach in an early childhood classroom. That made me think about, perhaps that's the next. And actually, there's several other ideas based on your questions, folks' questions here today. We will be following up for everyone who registered for this event with a follow-up email with contact information, with the materials that we shared in the chat. So you will also be able to access them in a follow-up email.
Great. Well, thank you again, everybody, and we hope you have a good day. We'll be in touch.